All right, let's jump right into some of the most critical conditions you'll ever face in nursing, inherited and hematologic disorders. We're going to give you a little preview of a powerful method that cuts right through the complexity so you can think like an expert when it really counts. You know, for nursing students and new grads, this isn't just some quote from a textbook. It's the reality on the floor. The stakes are just incredibly high. Knowing the difference isn't just about passing an exam, it's about patient survival, plain and simple. So think of this as your preview of how the CSMRN framework trains you to see these conditions in actual patients. We're talking about moving way beyond simple memorization to build a real, intuitive grasp of what's going on inside the body. Okay, first things first, let's talk about the biggest challenge, the one that trips up so many students when they're trying to learn these disorders. It's basically a problem of information overload. A lot of students can, spit back the definition of hemophilia or leukemia, but they just freeze up when they get a complex scenario that asks them to prioritize. They can't connect the dots between the name of the disease and the immediate threat to the patient's life. Does that sound familiar? Yeah, if it does, you are not alone. And that is the exact problem that CSMRN is designed to solve. It's all about turning what you know into what you can actually do. So how do we fix this? Well, the answer isn't to just memorize more facts. No way. The solution is to use a structured framework that starts by asking one really simple question. Where is the problem actually coming from? And here it is. This is where it all starts to click. It's so powerful. Instead of trying to juggle a dozen different disorders in your head, we start by boiling them all down to just 3 possible origins. Is the core issue with the clotting factor, the platelets, or the hemoglobin in the red blood cells? All of a sudden, this huge, complex topic becomes totally manageable. So if you think through this framework, you see a patient with bleeding into their joints, which is a classic sign, by the way, and you can immediately think, that's a problem with the clotting cascade. It points you straight toward a clotting factor disorder, something like hemophilia, even before you've looked at a single lab value. Okay, so let's move to the next part and see how this all connects. Once you know the origin, you can instantly pinpoint the patient's most immediate, life-threatening risk. I mean, if the origin is a problem with clotting factors or platelets, the logic is super simple. The patient's number one risk is bleeding. Your entire assessment, your whole plan, has to be centered around preventing and managing a hemorrhage. But if the origin is that abnormal hemoglobin, like in sickle cell disease, the whole game changes. The primary risk completely shifts. Now your top priority is oxygenation. You're thinking about and anticipating a vaso-occlusive crisis, acute chest syndrome, all problems with perfusion. And let's throw another one in the mix. What about leukemia? That's a malignant growth of white blood cells, right? So the immune system is compromised. The primary risk isn't bleeding, and it isn't oxygenation. It's a catastrophic infection. When you see that combination of symptoms, especially that fever, your infection risk alarm bells should be going off like crazy. Sure, the bruising might make you think about a platelet issue, but the systemic signs, the whole picture, points to a compromised immune system. Infection becomes priority number 1. Using this framework, this becomes a really easy call. Low platelet count, that's a platelet origin. The primary risk is bleeding. So the critical nursing priority is to recognize that high risk and question whether the procedure should even happen at all. So here's the crucial part. It's how all of this comes together into a simple, powerful, and repeatable formula. This is what takes you from being a student who just knows facts to a clinician who makes life-saving decisions. And this slide just lays it all out perfectly. It's a 3-step method. Step 1, identify the origin. Is it a clotting factor, like in hemophilia, or a white blood cell issue, like in leukemia? Step 2, pinpoint the risk. Is it bleeding, oxygen, or infection? Step 3, prioritize your actions based on that risk. This mental model works for any scenario, from an exam question to the bedside. It's not about having every single fact memorized. It's about having a reliable system to interpret the data that's in front of you and take decisive, confident action when it matters most. All right, let's wrap this up by talking about what this all really means for you, for your practice, and your career. And this is the fundamental shift. We're moving away from just reacting when a patient starts to decline and toward anticipating it because you have a solid understanding of what's happening underneath. That is the hallmark of an expert practitioner. And that's the bottom line, isn't it? This isn't just some academic exercise. The ability to see these patterns, to connect the origin to the risk, is a skill that directly translates into patient safety. It saves lives. What you've seen here is just the beginning. The full, in-depth framework for these topics and so many others is waiting for you inside the CSMRN materials. So the final question is pretty simple. Are you ready to stop just memorizing and start really thinking like an expert?